broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's session. My name is Mara Rashid, and I'm the Marketing Manager at Persevia. The purpose of today's webinar is to discuss MIPS changes in the 2019 Quality Payment Program Year 3 proposed rule. Now, I'll turn the time over to Amol Sawant. Our presenter today is a product owner at Persevia.
Thank you, Amara. Hello, everyone. Thank you for joining us for today's presentation. I'm Amol Sawant. I'm a product owner at Persevia. I'm primarily working on Persevia's meaningful use and clinical analytics solutions. I've been with Persevia for almost 6 years now, and I've been part of the US healthcare IT industry for nearly 10 years. Before I start the presentation today, please note that there will be a Q&A session towards the end. So please feel free to type in your questions in the question box. For any reason, if we are not able to cover all the questions asked today, we will follow up on the questions and also share today's PowerPoint slide. So with that, let's start today's presentation. The agenda is to get ourselves familiarized with the 2019 QPP or Quality Payment Program proposed rule. The rule was released just a few days back, and we will focus on those proposals in the rule which are related to the MIPS program. We'll take a look at some new concepts that are being introduced to MIPS. We will review changes proposed for previous requirements. We will also discuss where the program is headed in 2019 and beyond, and how can providers and health systems contribute in finalizing or changing the proposals. Let's first do a quick overview of the 2019 proposed rule. The proposed rule includes several changes to the MIPS program that aim to reduce administrative burden for eligible clinicians and put more emphasis on improving EHR interoperability. Now, in 2017, which was the first year of the program, 91% of MIPS eligible clinicians successfully participated. This gave CMS the encouragement to continue increasing the program requirements. At the same time, CMS has maintained certain measures of flexibility, particularly for small practices. In addition, the Bipartisan Budget Act of 2018 has provided additional authority to CMS to continue the gradual transition in MIPS for three more years. This will, in turn, further reduce the burden on clinicians. The proposed changes are perhaps more than many would have anticipated. Now, we won't be able to cover all of the proposed changes in today's presentation, but we will highlight some of the more interesting and important ones. And then we'll look at these proposals again in a bit more depth once the final rule is released. The final rule is scheduled to release sometime in fall. We don't have a date yet. Now, before we proceed, let's take a quick look at the Bipartisan Budget Act and what changes are being introduced to the MIPS program in order to implement this act. There is a proposed change to how MIPS payment adjustments will be applied. The adjustments will not only apply to all items and services under Medicare Part B, but in addition, they will now apply to only covered professional services paid under or based on the physician fee schedule beginning with 2019. Another proposed change is to the way MIPS eligibility is determined. And the change is that the low volume threshold, which is primarily used for determining the eligibility will be calculated based on Medicare Part B allowed charges and Part B services. The low volume threshold calculation will now be based on allowed charges for covered professional services and the number of covered professional services furnished to patients. So this is an addition to the previous two categories, which were only looking at charges and number of patients. Another proposal is for the cost performance category. The cost category will have some flexibility in the final score for MIPS for 3 additional years. Instead of requiring the cost category to have a weight of 30% in the third year of the program, which would be 2019, the proposal is that the weight for cost category will be not less than 10% for the third, fourth, and fifth years of participation. So that's a big change, giving 3 more years to kind of get acclimatized and used to reporting on the cost category and also improving your performance. Now let's take a look at some of the important additions that have been proposed in this rule. The first addition is new provider types for eligible clinicians. This is a small change, but potentially has a very large impact. The new provider types are physical therapists, occupational therapists, clinical social workers, and clinical psychologists. For these new eligible clinician types, MIPS may prove to be challenging as they will not have the benefit of any transition years to get up to speed with MIPS. Till now, other eligible clinicians have had some experience participating in 2017, and again, they'll be participating in 2018. So by 2019, they would have had at least 2 years of experience working with MIPS. The new eligible clinician types, on the other hand, will need to be prepared for 2019 in order to be successful. Now, one good thing is CMS has proposed that for these new clinician types, promoting interoperability category be reweighted to 0. So there is some relief for these new clinician types in 2019. Another proposed addition is facility-based scoring. Starting 2019, facility-based scoring will be automatically applied to qualifying clinicians and groups. This will make it simpler for most clinicians and will not require them to do a separate data submission. But the data submission exemption is limited to individual clinicians only. Groups that qualify for facility-based scoring will be required to submit data for improvement activities and promoting interoperability categories. Now, as I said, this facility-based scoring will be automatically applied to clinicians and groups who are providing at least 75% of their services in hospitals, emergency rooms, or other equivalent facilities. So the idea is that these specific clinicians and groups would in fact benefit by having a combined score with their quality and cost categories. Now, it's estimated that this will still be a fairly small number of clinicians who meet the 75% requirement, but for those who are eligible, it's a very big relief for them in 2019. Another proposed addition is the use of new MIPS terminology. This new terminology helps formalize submission methods and protocols and more accurately reflect how clinicians and vendors interact with MIPS. The first is collection type, and collection type defines that quality measure data can be collected in different yet functionally equivalent ways. Some of them are ECQMs or MIPS clinical quality measures or QCDR measures, Medicare Part B claims, CMS web interface, critical access hospitals for MIPS, and administrative claims. So all of these different methods to collect data are now termed as collection type. Another new term is submitter type. Submitter type defines that MIPS data can be submitted from multiple different and equivalent entities. Entities being eligible clinicians, groups, or third-party intermediaries. Lastly, submission type. Submission type defines that MIPS data can be submitted using multiple methodologies, such as you can either log in and upload on the QPP website, you can log in and attest, you can submit Medicare Part B claims, or you can report using the CMS web interface. So these are the more important additions that have been proposed as part of the 2019 rule. Now let's take a look at some changes that have been proposed to components that have been around for 2017 and 2018 performance years, but they may change in 2019 if these proposals are finalized. Now, most of these proposals are evolutionary changes to the existing MIPS scoring and reporting criteria. So even if they are not finalized for 2019, it's quite possible that in 2020 or maybe the years beyond that, some of these proposals will come into effect. The first one is performance threshold. For 2019, the performance threshold is proposed to be 30 points. Now that is up compared to 15 points, which is for 2018, and in 2017, it was merely 3 points. CMS has stated that they intend to gradually increase the performance threshold in 2019 and beyond. Now around 2022, the threshold will be based on the mean of the final scores from the previous years. The performance threshold for exceptional performance for 2019 has been set at 80 points, which is higher compared to 70 points, which is both for year 1 and year 2, 2017 and 2018 of the program. Next is the proposed change to the low volume threshold. Previously, low volume thresholds were based on all Medicare Part B charges and services. The low volume threshold is now proposed to be based on allowed charges for covered professional services and the number of covered professional services. There are 3 components which will be used to determine the low volume threshold. The first component is that Medicare Part B charges need to be above $90,000. The second is that the number of beneficiaries needs to be above 200. And the new addition in 2019 is the number of covered professional services, which need to be above 200. If MIPS eligible clinicians meet or exceed 1 or 2 of these criteria, then they need to participate in the program. If they don't meet any of these criteria, they can be excluded from participation in 2019. There are some small changes to the performance category weight. The cost category weightage will increase from 10% to 15% in 2019, and thereby the quality category will decrease from 50 to 45% in 2019. Some changes have also been proposed for the improvement activities category. It's basically got to do with either discontinuing few activities or introduction of new ones. Specifically, 6 new activities have been added for 2019. 5 of the existing activities have been modified, and 1 activity has been removed for 2019. Now, for the promoting interoperability category, please note that this category was until 2017 known as advancing care information. This category will be reweighted to 0 for new clinician types, as I mentioned earlier, and it will also have some benefits for small practices and clinicians who face hardships like lack of internet and other uncontrollable circumstances. So if they meet any of these criteria, this category will be reweighted for them to 0, which will in turn be added to their quality category instead. One thing to note, which is very important, is that CMS no longer provides the flexibility of using 2014 edition certified EHR technology. As part of the proposed rule, eligible clinicians and groups must use 2015 certified EHR technology. CMS is also proposing a new scoring methodology for this category. Previously, this category was divided into base score, performance score, and bonus scores. Now, these 3 types are being removed, and this category will now only use performance-based scoring for each individual measure. One welcome change is the support for multiple collection types for quality measures. Starting 2019, a single quality measure may be submitted via multiple collection types, and the types could be either a MIPS clinical quality measure or an ECQM or QCDR measures, Medicare Part B claims, etc. The measure will be scored on the data submission with the highest achievement points. So it is really encouraged that if you are able to report a single measure via any of these different collection types, please go ahead and do so, because it will be up to CMS to evaluate and compare your scores using these collection types, and then just pick the one which gets you the highest score. Now let's take a look at what is the impact of these proposals on 2019 and the coming years. Today we've already talked about eligibility changes, changes to performance, and changes to exceptional performance threshold. And we've also looked at changes to scoring methodologies. And maintain. Important to note that cost component or the cost category will be key moving forward. Based on 2017's performance, we can deduce that most clinicians were able to score quite well on the 3 interoperability and improvement activities. If this trend continues, which it's quite likely that it will, then the true differentiator between the performances of different clinicians and groups is going to be the cost category. If all of these proposals are finalized, then in the year 2022, the performance threshold will be set to the mean of the performance of previous years. This means that each eligible clinician will have to be better than average in order to not be penalized. What we are seeing is as years progress, providers are going to keep improving their MIPS scores, and which will in turn keep increasing the average score across multiple providers. Any providers who don't keep up with this increasing average are going to have a hard time avoiding penalties or even get positive adjustments. So it's really important to not only keep updated with all of these proposals, and also keep continuing to improve performances. Now, please note that these are all still this is a part of a proposed rule. CMS does allow physicians and health systems to comment on these proposals for a 60-day period. So it is highly encouraged that providers review the legislation and submit comments to CMS so that CMS can consider them when determining the final rule. Comments must be submitted by the close of the 60-day period, which would end on September 10th, 2018. Now, when you're sending comments to CMS, fax transmissions will not be accepted, but comments can be sent either electronically through regulations.gov website, or through regular mail or overnight mail, or using a courier service. And as I said earlier, final rule is expected to be published around fall, which is when we will be able to do an in-depth discussion of whichever proposals get finalized from this rule. Now, that is all I had for today's presentation, and we can now start taking some questions.
All right. Thank you, Mo. We'll go ahead with questions now. Just a reminder, please be sure to type your questions in the questions box in your control panel, and we'll answer them for you. It looks like we don't have any questions as yet. Let's see if there are questions coming up. It seems like we don't have any questions for now. Amol, is there anything else you wanted to cover before I wrap up?
No, so just that we will be sharing this PowerPoint presentation and the recording after today's webinar is wound up. And if you can think of any questions that you want Persevere to answer, you can even email them to us. You can either contact your account managers, or you can reach out to Persevere Sales, and we'll be able to respond to your questions via email as well.
Yes, if there are any questions from you guys, you can reach out through our email, sales@persevere.com or info@persevere.com, or you can just visit our website and drop a query over there, and we'll be happy to answer that for you. So great, thank you everyone. We appreciate you being here. We'll email you, as Amol said, we'll email you the slides and recording from today's session. And thanks once again for joining us. We'll see you next time.
Thank you, everyone.